Uh, Hello everyone, I am Dr. Amaresh Biradar. I am a board certified plastic and cosmetic surgeon practicing in Karnataka, Kalaburagi. So today we will speak about fillers. These are filler injections. So where are these commonly used and what are the indications? Filler is basically made up of hyaluronic acid and along with that it has a lidocaine. So fillers are used for the aging face appearance, to look youthful, to enhance the facial features, and fillers for the body is also available, like breast fillers, buttock fillers, calf fillers and all. But majorly fillers are used for the face. So where all we use is we use it for the around the eyes, if for the youthful appearance of the around the eyes, for blackish discoloration around the eyes, for the non-surgical rhinoplasty of nose, where if there is an indentation or depression on the nose, or if there is a parrot beak appearance of the nose, in those places we inject this filler. For chin enhancement also we use the fillers. For lip enhancement, lip thickening also we enhance the nose. Few people have a thinner lip on the one side and thicker lip on the other side. For those conditions also we inject fillers and give a balanced face appearance. For nasolabial crease, many people with the age, the nasolabial crease becomes more prominent, which gives a more aged appearance. In those conditions also we use this fillers. Fillers comes for somewhere around 18 months to 2 years. After that it needs refilling, as it's a bio dissolvable material, it gets dissolved after that. And if there is something over correction or anything, by injecting hyaluronidase injection, that's an enzyme, it can dissolve the filler. So these fillers are very safe. It is done by a board certified plastic surgeon or a well trained doctor. So for knowing more about fillers, you can call our office number 907 111 7244. Thank you.